In Chapter 9, Bone, Joint and Muscle Trauma, we'll talk about the causes, signs and symptoms, as well as the management of various tendon, joint and muscle injuries. We'll also learn about the causes, types, signs and symptoms and management of fracture. We'll start with introducing the skeletal system. There are 206 pieces of bones with various sizes and shapes in the skeleton of human body. The system has three major functions. First, it supports our weight and body framework. Second, it organizes movement through coordinating with joints and muscles. Third, it provides protection for vital organs. A joint is where one bone meets another. Most of the joints are movable, and the bone ends are joined by fibrous tissues called ligaments. The ends of the bones are also covered by smooth cartilage. The degree and type of movement depends on the way the ends of the bones fit together, the strength of the ligament, and the arrangement of muscles. Muscles are formed by muscle fibers and connective tissues of various shapes and sizes. There are three different types of muscles, including skeletal muscle, smooth muscle, and cardiac muscle. Skeletal muscle performs certain functions. It maintains body posture and protects internal organs. It also controls body movement with bones and produces heat by muscular movement to keep warm. There are four common types of tendon, muscle and joint injuries, namely muscle cramp, muscle strains, sprains, and joint dislocation. Muscle cramp is a sudden, painful spasm. It can be caused by inadequate warm-up exercises, catching cold, dehydration, and electrolytes imbalance. Signs and symptoms include muscle pain, stiffness, and spasm. The victim will be unable to relax the contracted muscle. He or she will also find it difficult to move the joint of the injured part. How should we manage muscle cramps? You can first comfort and reassure the victim, then massage or stretch the cramping muscles to relax them. If the victim has cramping of toes, help him or her to stand with his or her weight on the toes, or sit on the floor or bed, lifting the toes upwards. When the spasm subsides, massage the foot. If the victim has cramping of calf muscles, assist the victim to sit down on the floor or bed. Extend the knee, hold the victim's toes and flex towards his or her shin. Massage the calf muscle gently after stretching. If the victim has cramping at the back of thigh, ask the victim to lay down on his or her back. After that, lift his or her leg with the knee straightened. If the victim has cramping of front thigh muscles, he or she may stand and lift the foot up with his or her knee bends back, then gently massage the thigh muscle. In case of cramping of fingers, ask the victim to extend the elbow slowly. Extend the fingers and draw the hand towards the body. Gently massage the spastic muscle in the forearm with fingers. To find out more about the management, watch the demo videos.
When the victim has muscle cramps, you should let him or her rest. Massage the cramping muscles gently or stretch the cramping parts softly. You shouldn't apply too much force when you try to stretch the cramping muscle to avoid further injury and muscle strains. If the cramps sustain for a long time, you can use cold pads to relieve the pain. In case of prolonged cramps, you should consider if there's any exhaustion or dehydration of muscles. In the former case, the victim has to stop all the activities and rest. In the latter case, the victim needs to replenish water and electrolytes. Management of cramping of toes. You can help lift the toes of the victim upwards. When the spasm subsides, massage the foot. Or help the victim stand on the toes. Management of cramping of calf muscles. You can assist the victim to extend the knee. After that, hold his or her toes and slowly flex towards his or her shin. Massage the calf muscle gently after stretching. Management of cramping of thigh muscles. Cramping of back thigh muscles. You can lift the victim's leg with the knee straightened. Cramping of front thigh muscles. The victim can stand and lift the foot up with his or her knee bent back. Cramping of fingers. The victim may extend the elbow slowly. Extend the fingers and draw the hand towards the body.
The second most common muscle injury is muscle strains. Muscle strains occur when muscles are overstretched, causing partial or complete torn of the muscle fibers or soft tissues. Signs and symptoms include sudden pain of muscle, and the pain is aggravated during movement. There may be swelling or severe muscle spasm. If back muscle is strained, the victim may not be able to stand or sit properly. You can remember the management of muscle strains by the acronym RICE, RICE. R stands for rest, which means placing the victim in a comfortable position and rest the injured part. I refers to ice, which means applying ice pack or a cold pad to the injured part. C represents compression, which refers to the application of pressure and the use of bandage to stabilize the injured part. Finally, E refers to elevation. In other words, elevate the injured part to prevent swelling. Ask the victim to seek medical advice if the conditions get worse or swelling is severe. We'll move on to talk about sprains of joints. The condition occurs mainly because ligaments are partially torn by a twisting force. There's usually no joint dislocation. Symptoms include pain on the injured part. Although movement becomes limited, the victim can still maintain a certain level of activity. The injured part also shows no deformity. The management of sprains is the same as that of muscle strains, which is RICE. R for rest, I for ice, C for compression and bandaging, and E for elevation to prevent swelling. Remember not to put ice cubes directly on the injured part to avoid cold injury of skin and sensory nerves. Cold therapy should not be applied for more than 20 minutes. Another common joint injury is joint dislocation. This is a joint injury in which the bones are partially or completely pulled out of their normal position. It is commonly occurred after strenuous exercise or when a strong force wrenching the bone into an abnormal position. Signs and symptoms include deformity of the injured part, severe pain, and disability of the injured part, swelling and bruising. If the extremities have numbness, paralysis, and become pulseless, the nerves or blood vessels may be compressed or damaged. To manage joint dislocation, stop the victim from all activities. Try not to move the injured limb and don't attempt to replace the dislocated bone into its socket. Use thick, soft padding to support and stabilize the injured part and place the victim in his comfortable position. After that, send him or her to hospital as soon as possible. In case of lower jaw dislocation, fold a triangular bandage in narrow bandage and use it to support the lower jaw and tie the knot on the uninjured side. If the victim has any denture, remove it before bandaging. Many accidents are actually avoidable. To prevent sprains and muscle strains, maintain sufficient lighting at home. When you reach object at high level, use reliable ladder. Keep your home neat and tidy. Use slip-proof mat on bathroom floor. Keep the floor dry and wear comfortable shoes with suitable heels. Do adequate warm-up exercise before sports. All these measures can help lower your risk of injury. Apart from joints and muscles, bones are also playing an important role in human body. If there's any breakdown, disintegration or rifting of bones, which then cause fracture, our movement and activity level will be greatly affected. There are 3 causes of fracture. The first one is direct force. The bone breaks at the point where a force is applied. For example, a blow over the head causing skull fracture. The second cause is indirect force. The fracture site isn't at the point where a force is applied. For example, when you fall from height with the heel touching ground first and causing spine fracture. The third cause is muscle pull. The movement of bones turns opposite to the movement of muscle. For example, strong twist or wrench of triceps will lead to elbow fracture. There are several types of fracture. The first type is closed fracture, which refers to fracture with no open wound. There are 2 types of closed fracture. The first type is mild injury to soft tissues, which is also known as simple fracture, and mostly caused by low kinetic energy force. The second type is serious injury to soft tissues, or complex fracture. It is usually caused by high kinetic energy force, which causes damage or death of surrounding blood vessels, nerves, or muscles. The second type of fracture is open fracture. In this type of fracture, the fracture site has an open wound and the broken bone may be exposed there. There are 2 types of open fracture. The first type is mild injury to soft tissue. It is usually caused by low kinetic energy force and the broken bone protrudes through the skin. The second type is serious injury to soft tissues, which is caused by high kinetic energy force that causes damage or death of surrounding blood vessels, nerves, or muscles. There'll be a large wound on the skin. The third type is green stick fracture. It's usually found in children, in which a side of the bone is split or cracked, while the other side is complete or bent. The signs and symptoms of fracture include pain and tenderness and swelling at the injured site. There may be bruising. The injured limb will become weak, deformed, irregular, or shortened. The victim may lose his mobility in the injured limb and in the joints near the fracture site. He or she may suffer from shock due to massive bleeding at the fracture site. However, the above signs and symptoms may not appear at the same time during fracture. We should manage any suspected cases as fracture if in doubt. And in case of open fracture, we should manage the wound first.